you help people with neck pain? And if so, how does the Egoscue differ from other modalities?
Yes, if it happens, if it's a pain that you feel in your body, we can help you. And something that might sound very basic is your neck is still a part of your spine. So usually when someone is dealing with neck pain, we want to look at what's happening right below the neck. We want to look at your shoulder position, and we're also going to want to look at your hip position, because that dictates what your whole spine is doing, and your cervical spine is a part of that. So most of the time when people have neck pain, we do see that either there is a shoulder elevation, or there's rotation, or one hip is tighter, or all of the above. And we'll be able to address that symptom by just getting after the joints that are supporting the spine.
Great. Carrie Ann, how about you?
Yeah, of course. And I think the way that it differs from other modalities when treating the neck is similar to how we treat everything else. It is, you are moving your body into that position. Neck pain at a chiropractor, and I like chiropractic care, but it can be very scary for some people to have your neck adjusted. So we're not we're not pushing anything back into place. It is moving over time, and all you're doing is putting your body back in the position it was meant to be, and it happens when it's ready. It is a process, and you'll feel relief soon, but it's the repetition of doing it that makes it feel better. So that's how we differ from other modalities. And it can be gentler because of that. And it shouldn't be scary, because I know going to a chiropractor with your neck can be a very scary thing for some people.
Sure. Great. Lisa?
Yeah, I would say both of those are pretty spot on. And I like the biggest difference with us compared to other things is it's always the whole body approach. So even if it's, a hip issue or shoulder issue or even a neck issue, we're still going to look at everything because it all ties together. And then of course we work on, really educating you, how your hip elevation is contributing to, the neck pain that's giving you a migraine. Because a lot of times it's not just, shoulder position. The shoulder position is there usually because you're compensating for your hip. And I think there are some physical therapists or massage therapists who have now started to look a little bit just below, and they'll see okay, well, your shoulders are off. So then they might have them doing, their posture exercises. You're on a stability ball, you do eyes, Y's, and T's, you do a bunch of band stuff, you do chin tucks. But at the end of the day, it's still coming from somewhere. And a lot of times, well, pretty much every client that we see, we kind of do a zoom in, zoom out. So we're going to look at, okay, this is the symptom. This is the area that they're talking about, which happens to be the neck pain. So you can maybe see they have a little head tilt, or one shoulder's higher, one shoulder's rounded forward. So that's all in the immediate vicinity. Then you have to look at, well, what else is there? Okay, interesting. Their right foot turns out a lot more. Their right hip is higher. That when they walk, they have this kind of funky twist. So you have to really see what is causing those other things. And then that's how you get to actually addressing it. And then by using corrective exercise, you're retraining your body to do it yourself. So I've had, over the years, many clients who have, gone the traditional route, gone to PT, gone to a massage therapist. One thing that they really appreciate about having come to Egoscue is they can do it on their own. So, it's not always smooth sailing with the therapy process. There are, road bumps along the way. It goes up and down. But I had a client who said this to me once, now if I have a flare up, it'll take some time, but I can do my tower and my menu. It might be 2 hours, but I don't have to wait for the chiropractor to open. I don't have to wait to try to get an appointment for the massage therapist. And I just have to, take Advil or take pain pills or sit on ice and just ride it out until I can go see that person. I can do something now. Yeah. If it's, 5 o'clock in the evening or 2 in the afternoon, they know what to do to help themselves feel better. And in some cases they can totally, get themselves out of it. But at least if they can't, then it's okay. Well, I can feel better, take the pain down until I can have a discussion with, the Egoscue person you're working with. And sometimes it can be a quick little email like, hey, I have this, can I make a quick adjustment? Or, sometimes you're coming in for an appointment. But I think that's one of the bigger differences is we really try to educate people on the root cause and then how to address it and how to address it on their own so that they don't have to rely on coming in or going to see somebody or having an appointment or hoping that they have enough visits on their insurance to be able to, get their body feeling good.
Totally. No, it's good. Good discussion going into the function of it too, and some of the asymmetries that people can see with the foot turned out. It's one thing when people call in, even sometimes on the phone, we'll take them through, just go ahead and stand up for a second, take your shoes off and, put down the phone for a second, but just close your eyes or put in a speakerphone and then feel where your weight distribution is. Does it feel heavier on one side versus the other? A couple things that you can look at also. So if it's asymmetrical there, and they have asymmetrical neck pain, like it's tighter on one side or hurts all the time on the same side, it's like, okay, well, there's a weight imbalance there. So it's not uncommon that someone, like you said, Lisa, has a foot that's turned out. If we can get the foot not forced realigned, but subconsciously, posturally, functionally realigned, then now their hips can actually bilaterally stabilize. And like Emily's point about the spine, on top of that, it's now on an even foundation of a pelvis to sit on. And from the pelvis up, it's like a whip. The pelvis, the base of the spine, the sacrum would be like the handle. And then by the time you get up to the top, that's the end of the whip. And so if every time they're stepping and they're not getting the stability or the coordination of the parts underneath the legs into the pelvis, then that means everything's moving. So let's say that your right hip just isn't stabilizing. And every time you go to walk on it, it's doing this. Well, now the handle of the whip is basically making that movement, and then it's just vibrating up. And everything we do within our bodies functionally is to protect this, right? It's to protect our noggin to keep it safe. And so if we have muscles that are trying to brace above and beyond what they're normally doing, it's because they're trying to hold on and say, hey, stop doing whatever you're doing, because it's starting to disrupt what we have going on here. We have our inner ear for balance also. So another thing that people can look for, if you look in the mirror, look at your ear level, look at your eye level. If you notice that the one side's tilted, that also shows that you're asymmetrical in terms of how you're sitting. So other modalities might go to adjust that, but what we do is we look all the way from top to bottom in terms of how things are aligned. Because if someone's head is off, typically, like you mentioned, the shoulder's off, the pelvis is off. There's all these kind of asymmetries that are going on through the body, and they interact. So they might just enable the same dysfunctional patterns to go. So we want to take care of it all. But neck pain, surprisingly, is one of those things that is not usually a big deal too. Like it's a lot easier to handle. The problem is when the practitioners, if they're beating up the neck and not looking beyond that, that's, I would say, like you're saying, that's one of the big differences too. But a lot of times it's just a balancing act. How is this neck and head balancing over the rest of the body?